But let me just start by talking about WHO's vision, the World Health Organization, as Marcel and the EPFL president, Martin, said. We want to make sure that the whole world, everyone can live healthy and productive lives, no matter where they are and where they come from. So I just want you to hold that thought a little bit. Healthy and productive lives, no matter where you come from and where you are. Now, when you talk about medicine, it takes 6 years for a medical doctor to have a degree. It takes 200 days for a vaccine or medicine to be certified or qualified to be used once it is researched and tested. It takes many years to research vaccines and medicine. For a doctor in Africa to be practicing in Europe, it takes us additional 6 years. All to say that the medical side, on the medical world, or the medical ecosystem, if you want to call it that way, rigorous test and quality control is at the core of how we deliver the medical care. Because at the end of the line, at the end of a machine, at the end of a device, at the end of in the hospital, it's one life that is there that matters. Can be your life, my life, because any error can be fatal to any of us. So time to certify, to qualify, it's key. Now, I want you to translate that into the digital world, how the artificial intelligence can ensure that as we embark in this journey and as we adopt these new technologies, how can we make sure that it is robust, it's there for the greater good, it fulfills that goal of healthy and productive life for everyone, everywhere, and it does not harm anyone. So that's the challenge we have. We want to make sure that as we embrace artificial intelligence, machine learning for digital health, we are also making sure that we are not harming anyone. We have enough quality controls to make sure that we don't need to press a reset button, like in many computers, and then thinking that, okay, the patient will reset and everything will come back to normal, because there's no such a thing. And that's the challenge that we face. And that's the challenge we want to make sure that as we support and embrace the progress of digital health, not just because digital health will address all the health problems the world has, because, by the way, 49% of the world is still not connected. We just celebrated the 50-50 mark on the broadband. Only 51% of the world is connected by broadband. So there's another 49% that's still not connected. If we talk about digital devices such as the ones that use internet, I am wearing one of them, an Apple Watch, or another digital device that perhaps helps the blind citizens to navigate. So all these, how can we make sure that one, is safe to use, two, it reaches everyone, is affordable, and somehow it supports the WHO vision of healthy and productive life for everyone. At WHO, there are three areas that we look at when we think of digital health and AI for digital health. One is the governance. the other one is accountability, and the third one is affordability. On the governance, we want to make sure that it's safe to use. It passed all the rigorous tests that I mentioned. We have the challenge to transform the 200 days into maybe 2 weeks or 1 month, because technology, I always say 10 years of technology is equal 65 years of human life, because I don't think anyone here is wearing anything 10 years old from the technology perspective, because those technologies are retired. So how can we fast track this, the certification for safe use? How can we make sure that ethically it's ethically correct and does not violate privacy rights? And how can we make sure that the governance mechanism that we put in place support countries to make sure that universal health coverage is achieved as per our ambition goals on the Vision 2030, which is the Sustainable Development Goal for health for everyone. That's on the governance side. On the affordability side, we want to make sure that digital health is part of global good. It means that it is a technology, a solution that will solve not only the problem of the richest people, but will solve the problem of anyone in this world. And that's a challenge I put to EPFL, to you, the innovators of today and the leaders of tomorrow. On accessibility, so we want to make sure that as we deliver the AI for health or digital health, we also make sure that the 49% of the world that is not connected can benefit from the same technology. Because in the vision of a Sustainable Development Goal for health, which is, we promise that in 2030 we will achieve the vision of the whole world having health for everyone, better health for productive lives, and productive lives for everyone, no matter where they are and where they come from. With all these now, I have a challenge that I would like to put forward to you. The challenge I have is, can you help the World Health Organization to have an algorithm, or an artificial intelligence algorithm that allow us to measure the ability of the whole world to achieve that particular vision that I just mentioned? Healthy and productive life for everyone, no matter where they are, or no matter where they come from. So how can we actually leverage on the global good of artificial intelligence to be able to measure, predict better than the way we predict weather forecast, 24-hour weather forecast, which I think nowadays is quite accurate. How can you help WHO to develop that algorithm that would give us, with a better precision than a 24-hour weather forecast, on the ability of the world, can be at country level, village level, to deliver on the vision of healthy and productive lives for everyone, everywhere, no matter where they are and no matter where they come from. So with that thought of the need to be rigorous, the need to have health care accessible to all, the need to ensure that the technology, AI, is used for a greater good, for good purpose, and then ensure that we have mechanisms that allow us to certify that, I want to just put that challenge to you to say, we are prepared to partner with EPFL, with individuals that can help us deliver that social agenda of a healthy life for everyone, no matter where they are and no matter where they come from. Thank you.